Hi, I'm Dr. Daugherty, and I'm the Health Commissioner for the Ashland City and the Ashland County Health Districts. I'm extremely pleased to be a part of this 50th year celebration for the Ashland County Health Department. As you know, the Health Department was founded in 1947, and out of the 88 counties here in Ohio, there are slightly greater than 120 health districts. Although many people feel that the county and city health departments are combined, we actually have separate boards, separate budgets, but we function under the same location and share the same staff. We are a board-governed entity, having members of a Board of Health for the county and a Board of Health for the city, all of whom are appointed and serve 5-year terms. Our scope of services include nursing, environmental health, vital statistics, women, infants, and children nutritional programs, early intervention, Bureau of Children with Medical Handicaps, and school health. As you watch this video, these departments will be further explained. I hope that this will be informative to you in better educating you with the health department and what we do. Thanks.
The Ashland County and City Boards of Health are a cooperative department. By that I mean that for the last 50 years, both the City Board of Health and the County Board of Health have shared the same facility and staff. Both boards maintain their independence in the fact that we do have 2 separate boards serving the city and the county, and they have 2 separate budgets by which they are financed. On the County Board of Health side, the members, of which there are 5, are appointed to 5-year terms by the District Advisory Council, representing the townships, the villages, and the county commissioners. The County Board of Health adopts the budget. They have authority to adopt the rules and regulations for the district. They hire the health commissioner, and they hire the staff to do the work. The County Board of Health is financed by a 4/10 mil health levy, office receipts from the collection of licenses and permit fees, where we receive a state subsidy money from the Ohio Department of Health, and we also receive various grants, along with an apportionment from each township and each village within the health district. On the City Board of Health side, there are also 5 members, plus the mayor of the city of Ashland. They're elected to 5-year terms, appointed by the mayor and approved by City Council. They're financed through the City of Ashland General Fund, each year an annual appropriation, along with office receipts and state subsidy money as the county and the Ohio Department of Health.
One of the many functions of the Ashland County Health Department is overseeing operations at the Ashland County landfill. But probably more noticeable to the general public is their involvement and inspection of more direct environmental health entities such as water and solid waste management systems. Registered sanitarian John Cadley tells us about the other functions of the Ashland County Environmental Health Division.
Environmental health programs we deal with in the county is the private home sewage disposal system program. We issue permits for and inspect the installation of private home sewage disposal systems. We also issue permits for and inspect the installation of private water systems in the county. But one of the other programs that we spend quite a bit of time on is the food service operation program, and this is both in the city and county. We approve plans for, license, and inspect all food service operations in the county and city.
Along with doing food service inspection, the Environmental Health Division is also involved around the county in ways most of us never think of.
All campgrounds, all public swimming pools, and all manufactured home parks in the city and county. We have a solid waste program, which involves in part licensing an Ashland County landfill. We are involved with vector control, investigating complaints and problems involving rodents, mice, insects, cockroaches, flies, mosquitoes, and so on. We are also involved with investigating animal bites. Nuisance control program is another program that takes up a lot of our time. These are general health-related nuisances that we try to investigate and abate. Public school system, we're involved with a state mandate that requires us to inspect all public schools within the city and county. And a new program we've been involved with recently is licensing and inspecting tattoo parlors within the city and county. I'd like to mention that we do have a radio program every so often on WNCO, on the Town and Country section, that we try to elaborate more on these programs that we're dealing with.
Other areas of the Ashland Health Department are the Early Intervention and the Women, Infants, and Children's Division. These programs take care of a variety of our children's needs.
The WIC program stands for the Women, Infants, and Children Federal Supplemental Food Program. WIC is a family-friendly program. In order to qualify for our services, you need to be a resident of Ashland County, your income needs to be below our guidelines, you have to have a health or nutrition problem, and you also need to be categorically eligible, which means you need to be pregnant or breastfeeding or have infants and children under the age of 5.
The WIC program is a USDA food program that sends items such as eggs, milk, cereal, juice, and formula to homes in Ashland County. WIC can be reached at 289-3359.
And if you need any help finding medical care, or if you need any help from any of the social agencies in Ashland, we can make sure that you get the right information that you need.
Registered nurse Marjorie Jarvis explains Ashland's Health Department vaccination program.
For the child to come back until they're immunized to the capacity that they need to be at their age. Some children, they know that by 2 years of age, they should be fully immunized until boosters happen at preschool. So that's our goal, is to get the children immunized so that their basic series is over by age 2. The nurse reviews the records that are brought back to her from the receptionist clinic clerk, and she reviews those records, tells the parents exactly what the child needs. She tells the parents where the injections will be given, what type of injections they are, and the way the vaccine, what the vaccine side effects will be. Also, when they're done, make a repeat appointment.
Along with taking care of our younger children, the Ashland Health Department takes care of our older children. Registered nurse Julia Jones explains what other programs are offered by our health department.
With HIV/AIDS infection still a very real possibility within our county, we still need education on the HIV virus. Here in Ashland County, I am the AIDS educator, and since there is no vaccination and no cure for HIV/AIDS, there's still the need for education. I'm available to do educational programs for anyone who would like to have one done. And here at the health department, you could call, and we have available all sorts of literature, statistics, anything that you might want to know about. In keeping with our goal of prevention and optimum health for children, nurses from our health department, along with the city and county school nurses and their volunteers, conduct vision, hearing, and scoliosis screening programs in all the schools within our city and county. Those students who don't meet the Ohio Department of Health guidelines for acceptable levels of vision and hearing are rescreened by our health department nurses. The students who are still having problems are sent referral letters asking that they see their own physicians or could go to one of our free clinics. 2 health department nurses screen all 6th, 7th, and 8th graders for scoliosis, which is a curvature spine, or when the back doesn't grow straight, because this can cause problems later in life if the curves are severe and not corrected. We screen during the child's growth spurt.